There are many ways to treat fibroids. You could use tablets, you could use surgeries. There's a procedure called uterine artery embolization. Basically, we just block the blood supply to that fibroid so that it's starved and then it dies and it begins to shrink. Or commonly, you can even leave them alone. So which fibroids should you leave alone? Commonly, very small fibroids that are not causing you any symptom at all. Fibroids that you didn't even know. You went for scan for something and they just accidentally or incidentally discovered it. Fibroids that happen in women who are perimenopausal, so women who are tending towards menopause and it's not causing them any symptoms, and generally fibroids that are very small, less than about 4 centimeters. So if you fall into any of this category, this might be a fibroid that you may not need to remove. Just leave it if it's not causing any fibroids, because fibroids are very common. 8 in 10 women of African or Caribbean descent will have fibroids. They are very common. The second option, which fibroid should you be using tablets for? Now, tablets don't cure the fibroids. They help you to control the symptoms. One of the commonest symptoms it causes is heavy menstrual bleeding. Other symptoms it may cause is pressure symptoms. So you feel a lot of weight down below, you're urinating too frequently than you normally would, you're struggling to poo, or around your legs you have large veins that are just showing. It's called varicose veins. Now, these are some of the pressure symptoms, and this is one of the reasons why you might use tablets to control these symptoms or to shrink them so that we can now plan you for surgery. So pre-surgical planning. Sometimes we use tablets, and some of these tablets come as injection form so that they can just shrink this and reduce the amount of blood you are going to lose during your surgery. So even women who are going for surgery, we might still ask you to use the fibroids or the injections so that it can help the surgery. Now, number 3, women who are going for the option where we block the blood supply to that fibroid. It's called uterine artery embolization or uterine fibroid embolization. Now, basically what we do is there are different blood vessels. They bring blood and nutrition to that fibroid. So what we go is that we block it. It can be done through the hand or it can be done through your groin. It's done by a group of doctors called interventional radiologists. You go home on the same day. It's a very easy procedure. The thing I just need to let you know about this procedure is that if you are planning future fertility, if you want to get pregnant in the future, please be a bit careful about this option. You understand? This is a very important information. So most people who suffer pressure symptoms, the fibroid is really big, you want to reduce the size, most people can go for this embolization method. But remember the caveat I've just mentioned. You want to be very careful. The other thing I want to tell you is that it can cause some pain afterwards. Sometimes you have lots of vaginal discharge, and some people can even start to pass the fibroid out through down below. It can help. So these are some of the pros and cons. Now, surgery. Who are the people that need to go for surgery? The first thing I need to mention is if you have a fibroid and they've said your fibroid is submucosal, you'll see they will say the different types in the scan. Submucosal are the fibroids that are in your womb and they can stop you from getting pregnant or cause a miscarriage. You may want to consider removing it. You don't necessarily need a surgery that cuts you open to remove it. It can be removed from down below, called hysteroscopy method. So from down below, we can put a camera and then take it out. Other fibroids that are quite big can be removed from up. So it can be removed through keyhole surgery. You don't need big cuts, or with robot, or we might have to put a small cut and remove the fibroid. This is especially for women who want to preserve their fertility. Then you may be needing surgery. But remember that I said for some women who need surgery that needs maybe cutting you open or using keyhole, in some instances, we may give you some injections or tablet before that to sort of reduce the sizes of these fibroids and make the surgery less bloody and easier. So these are the different fibroid treatment options. And these are the reasons why you might want to consider it or not. I've given you the advantages and the disadvantages. So it helps you with the information you have so that the next time you are discussing with your doctor, you can know, or it can guide you on which treatment you should be going for.